So this project is a little bit different. It's a combining critical time interventions project with the C1 kind of thing for people that are returning to the community from an inpatient experience of some sort, and enhanced care coordination for people who are already in the community that have multiple kinds of healthcare needs, complex situations. So we put these two purposes together to form this team of 4 individuals that we call co-pilot. It's 2 employees from Monadnock Family Services and 2 employees from the Monadnock Collaborative to try to be skillful at both the critical time intervention, which is a specific discipline, specific approach to helping people return to the community, and critical time intervention, which it's basically putting care coordination on steroids in order to make sure it's much more effective and positive. So we were awarded the funding for this in the fall and spent many months trying to get our head around how we would actually do what we promised to do in the RFA. And so we got a lot of expert help through the CHI and Kate Creary, who was really instrumental in helping us work out all the details for launching this project. So it took us a lot of months in the fall to try to scope out as much of the nuts and bolts as we possibly could to how we would make this work and how we would approach it. The critical thing being, of course, getting the personnel to do the work that we embarked on doing. So training them on CTI and figuring out how this would all come together. So it was, frankly, a lot harder than I anticipated, getting employees from very disparate perspectives to work in the same kind of approach. So we launched in January, mid-January, to take our first referrals and are still inching our way with baby steps into making this all come together. So what we're focusing now on, as you can imagine, are the day-to-day operations for how this thing is supposed to work and how people can figure out how they're going to work together in a new particular way, because everybody coming to the team has different perspectives and different skill sets and different masters that they're trying to satisfy, and so bringing them to the common sort of game plan is not always easy. So we're working on getting referrals and how's that process work. We're working on how will we document the things that we need to document for our record keeping and our risks and our outcome reporting, and what do we have to do to get the skillful staff to come together and make a team out of this new collection. What else would you add, Mary Ann?
So this is with Cheshire Medical Center, Monadnock Family Services, the Community Mental Health, and Monadnock Collaborative, who our organization has the ServiceLink contract. So ServiceLink has been doing care transitions with Cheshire Medical Center on a gentleman's handshake for the past 4 or 5 years. And so we leveraged that process, so to speak. So one of the challenges I think that has happened is when we think about this person-centered approach or patient-centered approach to collaborative work, some of the challenges are that the cultures of those 3 entities have different languages. So we've had to really learn to talk each other's language, so to speak. So that was a little bit more challenging than I thought that would be. And the other thing has been IT, technology, and sharing the information between the 3 organizations. We've moved that along a little bit, but we're looking forward to having the pre-managed system up and running so that everyone can see what has transpired with that one individual and how we are connecting the dots through the hospital and clinical setting, the mental health setting, and the community-based organizations. So we're moving it along. Any questions?
I think one thing that I'm learning about this is that it's hard to get these 3, for this project, 3 systems have to kind of adjust, right? The hospital, the collaborative, MFS, and that's easier said than done, to get the small adjustments to fine-tune a way that mutually come together and do something. If you're ever involved in this kind of project, don't underestimate how much time and energy it takes to get these systems to work together on a human basis. So people need to form different kinds of relationships and figure out how to work together, and that's not something that you can just sort of write a nice flow chart to make it all happen. people have to change their behaviors, and that's, as you know, very difficult for all of us. So I think what we're similar to the B1 project that was described, it takes a while, and a lot of time has to go into that sort of development of the way people will become a team. Thanks.